Alright, so we're getting to look at the differences between what? Three conditions of the spine. Okay? And this is known as what? Scoliosis, kyphosis, lordosis. Okay? Scoliosis, kyphosis, lordosis. See, this is lordosis. This is what? Scoliosis, where the spine is going to the side. This is kyphosis. Lordosis, there's a problem down at the lumbar area. Kyphosis, there's a problem up here, okay, at the thoracic region. All right. So let's get to look at all of them. Where you get to look at what we discuss each one of them. But at the end, where you combine all the knowledge, you can now know the difference from the images and all of that. All right. So that this scoliosis, kyphosis, and lordosis omitted are all spinal deformities. Okay. So they involve different types of curvature. Different part of the spine are affected. This is the best image for this. All right. So looking at the scoliosis now, this is scoliosis. Scoliosis. All right. From the definition, we say that it's a lateral side-to-side curvature of the spine. It is actually forming an S or C shape. Okay. So the plane affected is involves what? If it affects the coronal plane, that's the frontal plane. The symptoms: the patient will be having uneven shoulders. Right, one shoulder will be higher than another. Okay, there will be visible curvature in the back, and there will be back pain in some cases. What are the common causes? Sometimes it might be idiopathic, which is what? Unknown. In most cases it is unknown. Right, sometimes it might be congenital, present at birth. Sometimes it might be some neurological conditions that the patient later on developed in life. How can we be able to diagnose scoliosis? Physical examination. You can also do x-rays to measure the degree of curvature. All right. Treatment is what? You can just observe, or you could brace, physical therapy, or do surgery in severe conditions. Right. So let's move to kyphosis now. What is kyphosis? This is kyphosis. There's problem at the thoracic region. Right. So this one is what? An excessive forward curvature of the spine, creating a rounded or hunchback appearance. So hunchback, right? The back is kind of like what? Pointed out. So hunchback, okay? So it's creating a hunchback appearance. What are the planes affected? It is affecting the sagittal plane. Symptoms include the patient to be having a rounded back, a slowing posture, be having back pains, having stiffness, right? What are the common causes of this kyphosis? It could be due to poor posture of the patient. It could be what? Scheuermann's disease, which is a developmental disorder. Okay, it's a developmental disorder. It could be congenital defects. It could be degenerative diseases, right? Diagnosis could be, you could use physical examination, X-rays to measure the degree of curvature. Treatments include postural exercise and physical therapy, bracing, surgery in severe cases, right? Then how about lordosis? This is lordosis. Lordosis, the problem is at the lumbar region, okay? So it's an excessive inward curvature of the lower back. That's the lumbar region or lumbar spine, okay? It is creating a sway appearance. It means sway, yeah, actually swaying, you understand? All right. What is the plane affected? Sagittal side, okay, sagittal plane. What is the symptoms? We're having a prominent buttocks. Your buttocks is kind of like pointed out, okay? There'll be muscular imbalances, congenital spine issues, poor posture. Diagnosis, same thing as physical examination, x-rays. It's physical, things you can actually just see on the physical. You are doing x-ray just to have a documented form, just to confirm. Treatment include physical therapy, weight loss, bracing, surgery in severe cases, right? So with that, that's the differences between what? Scoliosis, kyphosis, and lordosis.